So is it a cure, or is it a treatment, or is it just a control of symptoms? So this is a question that all my patients ask when I try to write a treatment for them or medication for them. They prefer for it to be a cure. Some patients say that if it's not cure, I don't want to take it. So let's discuss in this episode the difference between the three terms or three ways of a treatment. So a cure, essentially, you are completely recovered from the illness. The illness does not exist. You do not need to take any medications or any treatment for this illness, and that doesn't happen very often. An example for this, that you had a fractured ankle, so you will be treated by, for instance, casting the ankle or surgery. You will suppress the symptoms, pain symptoms, with pain medication, and eventually you're going to be cured and the illness will go away and you go back to your normal life. Now, in terms of a treatment, and this is what we deal with most of the time, let's take an example of hypertension or diabetes. Hypertension or diabetes, there's no cure for them for the most part, but there are medications that we can take that can control the symptoms, control the blood pressure, control the sugar, and as long as you take the medication, everything is under control. But the minute you stop the medication, then the symptoms or the blood pressure or the diabetes will be out of control. So essentially this is considered a treatment and not a cure. And in terms of suppressing the symptoms, for instance, we're talking about pain. So if you have a fracture associated with pain, so you take pain medication that suppresses the pain while we treat the problem and hopefully cure it. Three different terms. What I try to express to my patients: take what's available. If there's a cure, we're gonna go for it. If there's a cure but we need time for it, then we treat the illness and we treat the symptoms until we get to a cure. If there is no cure, at least there are medications and ways to treat it, to maintain it, so you can at least live a normal life until we find a cure. Thank you.